Tell me where you're from.
South Florida, Coral Springs.
South Florida? What brings you here?
A lot of pain in the TMJ joints. A lot of people call it TMJ. It's actually TMD.
Yeah.
But for the sake of whatever anybody else calls it, I'm here to basically get this jaw fixed. A lot of people who do suffer from TMJ will know that it gets to a point where your body can only take so much pain before you start feeling anxious, you start feeling depressed, and you can talk to whoever you want to talk to, and they'll all tell you this is secondary depression or secondary anxiety. There's really nothing to talk about. You're just
Many people will tell you it's psychology.
yeah, they'll tell you it's in your head and this, that, and the other. But what they can't tell you is, why is your face so swollen? Why can't you open up your jaw? Why, when you do open your jaw, it's constantly clicking? Why can your friends chew gum as long as they want, but you can only chew it for a couple of minutes? Why is your vision blurry when you used to have 20/20 vision? You know, why did you always have a very high IQ and school came so easily to you, and now it's hard for you to write a simple email and your grades are declining to the point where you have to switch majors?
Yeah.
You were once a very social person, and now basically all you can think about is pain, pain, pain. Pain shrinks your world. That's literally all you can think about, that's all you can talk about, and you literally do anything to get out of that pain. And unfortunately, there are people out there, doctors included, who are aware of that, and their main goal is treatment plans and getting every ounce, every inch, every dollar out of your bank account and into theirs. And unfortunately, it could take a very long time until you understand.
Did you run into that a lot?
Oh yeah, definitely. Over a period of, I've had these TMD symptoms since 2001. It's now 2014, and basically,
Been through the gambit.
I've been through it, man.
So did you see physicians? Only dentists? Give me a rundown real quick.
Physicians, started with equilibration specialists,
Yeah.
and then it's TMJ, TMD specialists who specialize in injections of cortisone, which
Steroids. In the joint itself?
in the joint, in the
Yeah.
shoulder, and then you see splint specialists, and the splints make you feel great for a period of time, but it's not a long-term solution.
Yeah. It's an aspirin for a headache, basically.
Basically, over time, it's you develop headaches.
Let me ask you, do you get headaches, for example? Like, what are your main symptoms?
My main symptoms all started literally the day I put braces on, and they gradually increased in severity.
Yeah.
The actual symptoms that I had also increased. So you're basically starting out with blurred vision, headaches, pressure building in the ear, ringing in the ear, teeth knocking together. Your teeth used to fit together perfectly. Now you're always searching for a bite, and basically the symptoms progress to more severe headaches.
Yeah.
That are basically lasting longer, and they're increasing in severity, and then I don't care who you are, if you're in pain all day and nothing's working to alleviate that pain, pain causes depression.
Yeah.
Pain causes anxiety, and pain causes poor concentration, and basically it's changing your personality. So literally this one thing that up until recently, um, no one in the medical community, even to this day, really acknowledges as a true medical diagnosis. Um, it can be very, very difficult to deal with, because it's not like insurance companies are just saying, "Oh, this is a real thing. Yeah, we'll definitely help you out with
No,
this."
good
And,
luck with that.
good luck.
Yeah.
And then you see the oral surgeons, and they're going to want to do some exploratory surgeries, and um, your options are basically total joint replacement, total joint replacement, or total joint replacement. Extremely invasive surgery with no guarantee of relief.
Yeah.
And
Okay, let me ask you this. What kind of meds do you take that help you, if any?
the medications that I take now, which is very scary, is you start off with ibuprofen
Yeah.
and let your doctors know you don't like pills. We got to come up with something different.
Yeah.
Because just from experience or just from reading, that ibuprofen's ultimately going to stop working. And just as I suspected, ibuprofen turns into Vicodin. And once you enter the opiate world, you're screwed, because your body keeps on reaching thresholds. So Vicodin turns into Percocet, Percocet turns into the next one, and then this one turns into that one. And next thing you know, you're on Dilaudid. And it's just like, how did I end up on Dilaudid?
Did you wind up on that?
Finally, I'm on Dilaudid right now. And it's like, well, let's increase it. No, I'm not going back up.
So all
on
they're
Dilaudid.
offering you is a pill.
They're offering a pill.
A pain pill.
A pain pill.
That's it.
And thank God for my pain doctor, who's actually, coming up with alternatives, wanting to talk to my other doctors. Thank God for my splint specialist, who is incredible at coming up with splints and letting me know straight up, this is not long term.
Yeah.
You got to find something else,
Yeah.
And they are wanting to do nerve blocks, and you're thinking, wow, that needle comes very close to my eyeball. That nerve comes very close to my temple.
Yeah.
These are very risky procedures.
Let me ask you a question. Do you have any kind of burning sensations, or does you ever have something systemic going on, like down your arm?
Oh, for sure.
Describe that.
Essentially, when you have it as bad as I have, you never know what's what. Essentially, my pain is actually in the joint, and it literally comes down the peripheral nerves, and also the trigeminal nerves, obviously, in playing a role on both sides.
On both sides.
Most people who suffer from TMJ will also have a feeling of pain underneath, or a feeling of pulling on the side of the neck.
Yeah.
And that sometimes can go down to the shoulder,
Sure.
of stiffness, and sometimes that can actually go all the way down to the spine and to the lower back.
Yeah. How's your mobility? Like, if you move your neck, is it pretty stiff or is it pretty loose?
Sometimes it's loose, but on a bad day, if your jaw's tight,
Yeah.
your neck's tight.
Yeah, right.
If your neck's tight, your shoulder's tight.
Everything's tight.
And if your shoulder's tight, you can bet your fingers are numb,
Yeah.
or tingling, or burning. I mean, this thing literally affects every aspect of your body,
Let me ask you.
including your vision.
Yeah. Have you ever had a sensation like sweating on one side? I'm just curious.
Oh yeah,
Where? I mean, like the right side, left
Right
side,
side.
both sides? Right side.
right side.
Okay, because there's something called complex regional pain syndrome.
I'm aware of it.
That's a sympathetic mediated problem. That is not a sensory peripheral nerve problem.
Mm-mm.
That's probably where they were coming at you with stellate ganglion blocks, things like that,
Mhm.
shots in the neck. Did that help you?
Did not.
So they stick their needles in those the plexus, and it didn't give you relief.
Did not give me relief at all.
Okay.
And it can
What
also
about-
be very confusing when you add more medications. You got to understand every medication has a side effect.
Oh yeah.
So these complexities, you start off with a diagnosis of Yeah, you definitely have TMD, and then every medication that you add, anti-anxiety, antidepressant, uh, um, a a uh, a like a nerve block, so you don't go into
Sure.
spasm.
What about ketamine? They ever give you something called ketamine?
No, I definitely was not starting on that.
Okay, I'm just curious. Yeah.
Yeah, but I mean, when you're in the world of the gammas, like I was on Lyrica for quite some time, and then they switched that to uh, uh, Teratol, I
What
believe.
kind of MD was giving you these drugs? A neurologist?
Now I'm under the care of a neurologist, and thank God for that. I have amazing doctors,
Yeah.
and thankfully they all talk to one another. But as far as actually acting,
Yeah.
I'm actually here today under my own accord.
Right.
You have to be a proactive patient, or
You never know where it's going to wind up.
you're not gonna you're not gonna get better.
Yeah.
Because ultimately, my biggest concern is your body can only take constant pain so long.
Yeah.
Painkillers or not, your blood pressure is going to start going up, your heart rate's going to start going up, and so too are the medications.
Yeah. Well, hopefully we can help you. I'm going to try my best.
Yeah, I'm very optimistic. Any kind of relief, 20%, 30%.
Bring it down a few notches.
It's a big deal.
Yeah.
And then you can actually come off a little bit of these medications, and so to come down with some of the side effects, that is a big deal. And anybody who's suffering from TMJ will tell you,
Yeah.
20-30% is a lot.
That's a big part.
That's a big deal.
You took biology, right? Remember aerobic and anaerobic?